So Bushland Health Group, it started back in the late 1950s. It's a community-owned charitable organisation. We've got 3 residential aged care homes, 2 in Taree, 1 in Old Bar, with a total of 271 beds and nearly 300 staff. And we also have a whole bunch of independent living or retirement villages, 6 in total, with 2 more on the horizon.
One of the features of bushlands is autonomy for residents, and they're involved in their own decision making. How would you describe that experience for the residents?
Yeah, it's really important. I think it's something we all kind of have tried to do in aged care. I've been in aged care for over 30 years. So even though it's definitely a bit of a focus from the strength and standards perspective, it's not a new thing. The resident is at the centre of the care, and they do have the right to make their own decisions. And even people living with dementia can do that with even just simple choices. So, yeah, we very much support that.
It is a part of anyone's dignity, isn't it? Their humanity, no matter, I suppose, especially as they age, it'll become more important.
Yeah, yeah. It's if you think about it, it's tough enough to have to pack up your home and have to go into care, and people do struggle. And then to lose the ability to make simple decisions or complex decisions, it is important.
Yeah, it's a big change in life, and having the right people to care for the
Mm.
residents and also having enough time to work with the residents. How do you
Yeah.
think data inefficiency would affect the staff?
Yeah. There's certainly so much, and over the years, as I said, 30 years, I've seen the incredible increase in how much paperwork we have to do and how much, data we have to um, give to the commission and things like that. It can be very time consuming. So definitely having efficiency around how data can be captured and shared or looked at is very helpful.
Really, that should be the focus of the staff, shouldn't it? Caring rather than
Yes.
crunching numbers, working with paperwork.
Yes, I hear our executive care manager often says it's more paperwork than people work, or that was the Chris. Yeah, it should be more paperwork than paperwork, shouldn't it? Really,
Do you think that's increasing with more
the paperwork or the
regulations?
people?
Yeah, or the
Oh,
paperwork. Yeah.
paperwork definitely. Sometimes you question why do we have to report so much? We report so much, and why? For what purpose?
Yeah, I suppose it's good to have regulations, but it can be overdone, can't it?
Yeah, well, I went yeah, I went to the commission, the commission's conference down in Melbourne recently, and even the new commissioner, Liz Heffron-Webb, was saying, "Why are we capturing so much why are we asking for so much information? For what purpose?" So, I think when looking at systems and processes or trying to work out what we're doing, you always come back to, "Well, what are we trying to achieve?" So, definitely there's a place for having data, collecting data, but for what purpose? What are we trying to achieve?
Yeah, it can reach a point of diminishing returns, I suppose. How is the QPS integration? How has that been working for you, and how has that improved efficiency?
No, it's been really good. So it's been an interesting process, fairly new to me, as I hadn't really had much to do with it before. My predecessor was initially involved with the team at QPS to work on the integration. But having been in aged care a long time, I know how much time it was taking to collect all the NQI data for the quarterly submission. It was quite a manual process. So it's been fantastic now that it's being pulled. QPS is able to pull it from our Telstra Health systems. And yeah, it's definitely been a time saver and going to be even more of a time saver as we work through and tweak some of the ways that it happens. So, for example, it's QPS pulling the data that we need to now report on some of the new quality indicators, like around allied health. So, absolutely, I can see that it's going to be a huge time saver. Otherwise, we're going and manually looking up all the information. But as with any new system, it does require a little bit of tweaking because we've got to work out which part of the assessment for us, Telstra Health System, is going to capture the data for QPS to pull out. and then do our staff know that this is the process that now needs to be followed. So with any system change, there's always a need for a little bit of tweaking and working with people. But QPS have been fantastic at supporting us through that, and being in touch and working through it, listening to what our challenges are and just coming up with other solutions and potential solutions, and just being very open-minded to wanting to work in with us rather than this is how it has to be for their ease. So
Yeah, the collaboration and the flexibility would be an up point because I suppose a lot of designers and engineers can make it for themselves and not so much the usability. So that back and
yes.
forth is a good aspect.
Yeah, it's actually, if I think back to other experiences I've had in my career, it can potentially become really complicated. But no, it's working with these guys, I can see that it's just keeping it simple is the best way. So yeah, they definitely listen and want to work with us. And it's really helping us, really nail our polypharmacy data or our I can see with the allied health professional data, it's going to be very beneficial once we just finalise these last few tweaks with how we make things work here at Bushland. They're going to fit in with us.
And have that peace of mind that you know that the data is accurate. You can sleep at night just knowing that's one less
Yes.
thing to have to worry about.
Yeah, yeah. And, again, it's a new thing that we're doing. So it helps us, having the data there like that helps us initially to go, hang on, that doesn't look right. I actually know that something's not right there. So it makes us go back to our systems and processes or our staff understanding of how they should be recording things. And we can provide support to them to record things a little bit more accurately. So yes, it will definitely the system and process is there to support accurate data efficiency and capture. But it's a new thing, so there has been some tweaking. I'm really enjoying working with the QPS team on trying to problem solve that, and I actually surprised myself a bit with how my brain works with coming up with suggestions and things like that. Yeah, it's good. It's good to collaborate and work together to try and find a way to help others and try and just keep going in
Rather
this
than
wild world.
something off the
Yeah.
shelf and then that's what it is and it doesn't
Yeah.
change. Yeah.
And no, and I think that some people or places do tend to do that. It's just way more complex than that. And you just end up finding unintended consequences. Just when you think you've nailed something, something else will come up and it's like, wow, we didn't think of that. So, okay, what do we need to do to, and they're very open to listening to that. So, yeah,
Uh,
we work together really well.
yeah, it's so
And I'm learning all sorts of things about computer side of things with terms like data dictionary and things
Oh,
like
yeah.
that that I've never heard of.
So everyone's learning.
Yeah.
What features would you say are the most useful and beneficial from the QPS integration?
It is early days for me to be using it. I've just stepped into the role now where I start to write the reports, but it's been really useful to just go back and have that real time data. I can go back, for example, and just go, okay, I'm reporting now on how many people, where we are at with our allied health. And I can very quickly see that, these residents were referred to a physio and were seen. I can very quickly pick up where the gaps are, if there are any, or the same with polypharmacy or psychotropic drug use. I just go into QPS and I pull up that NQI side of things, and there it is. I can find that data so easily and quickly rather than going back through Telstra Health and trying to find it and go, hang on, that didn't sound right, or I just need to double check that, or I need to make some further comment on that in my report.
Yeah,
Yeah.
so having been able to see issues and risks as well, detect those before they become
Yes.
too hard to
Yes.
deal with at a glance as well.
Yeah. It's great because the quarterly reporting, yes, at a glance, you can see where you're sitting against other organizations. But we still need to provide some commentary around what's happening. It's great. It's showing us our trends, but to provide that commentary, now to be able to go back in and have a look at how what that data is actually saying for that particular indicator really helps. So we have to write a report because you go to meetings and you have to share the data and what the data means, okay? Because you need to know what's working well and what isn't. And how do you know if you haven't got data to support you with sharing with the relevant people what's working well and what isn't? So what I find when I have to write a report, for example, on my on the clinical KPIs, yes, I can see from the QPS quarterly reports what the trending is, where we're sitting at from a benchmarking perspective. But then I can actually go in and drill down really easily inside that QPS, the page that relates to whatever facility I'm looking at, and just find the more detailed data, which really supports with providing commentary and providing an explanation as to why something might have jumped or gone down, or just helps you pinpoint so you know where to dig deeper if you need to.
That's fantastic. But on a broader look at aged care, what do you think are the main issues facing aged care at the moment?
I really think it's just it's workforce. It's finding people who wanna work in aged care, and then when we do find lovely, lovely people from overseas who come and work with us, they're settling into a new country, a new culture, perhaps English is a second language, and then the wonderful complexity that is in aged care in Australia and all the, regulations and expectations. So, definitely, yeah, trying to find the right people, find enough people, and then support them with what they need to do is probably the biggest challenge, to be honest. A lot of other providers would be feeling the same thing, with the strength and standards coming. What is that really gonna mean? There's plenty of resources and things out there. Sometimes I think it's too much and a bit overwhelming, but when we see once we see what this new re-registration process is gonna be, what we call accreditation, we might all start to settle down a bit and have a breather. What's it
Yeah.
actually gonna look like? Yeah,
There is a lot going on and a lot
there's a lot
up in
going
the
on.
air. Did you find that delay in the standards, did that help you, or did it sort of just prolong the
I
inevitable?
think I think it just prolonged the inevitable. I think we were ready to go really, and it was gonna be we're just constantly looking at what we're doing and how can we do it better. That's not gonna change after the 1st of November, and it wasn't gonna change 30th of June to the 1st of July. So, yeah, it probably would have been good to just get on with it. That it doesn't matter. 1st of November's nearly here, so
Yeah,
yeah.
and we'll see what happens then, like, maybe things will smooth out a little bit.
Yeah, you know what? It probably won't because I think everybody's still trying to get their head around their new roles and responsibilities. So, but yeah, once, maybe in 12 months when most people have had, most organizations have had at least their first visit, we'll have a bit better idea on what they're looking for. Is it truly going to be what they're saying it's going to be? Or, yeah, but, back to QPS and data. Yeah, I think the system is there to really support us with data collection, and supporting us with our obligations to trend and analyze and find where we need to improve or go, wow, we're actually doing really well here. What are we doing so well? And how do we make sure we keep doing it and share it with our other homes? Yeah, I quite like it, really. I love data and compliance and quality. So I have lots of fun.
You're in the right place.
I'm in the right place.